How accurate are blood tests for lymphoma diagnosis? How accurate are blood tests for diagnosing lymphoma? This is an important question for many facing potential lymphoma concerns. Blood tests play a significant role in the diagnostic process, but they are not definitive on their own. Most types of lymphoma cannot be diagnosed solely through blood tests. Instead, these tests provide supportive information that helps guide further diagnostic steps. Key blood tests used in evaluating lymphoma include the complete blood count, or CBC. This test measures levels of red blood cells, white blood cells, and platelets. Abnormal levels can indicate bone marrow involvement or systemic effects of lymphoma, but they are not specific enough to confirm a diagnosis of lymphoma. Another test is the blood smear, which examines blood cells under a microscope. It can sometimes detect lymphoma cells in the blood, particularly in certain subtypes, but this is relatively uncommon. Elevated levels of lactate dehydrogenase, or LDH, can indicate tissue damage and are often higher in aggressive lymphomas. While this helps assess disease activity, it does not confirm a diagnosis. The erythrocyte sedimentation rate, or ESR, measures inflammation in the body. An elevated ESR can be seen in lymphoma, but it is nonspecific and can occur in various conditions. Flow cytometry and immunohistochemistry are specialized tests that analyze blood or biopsy samples to detect specific markers on lymphoma cells. However, these tests are typically performed on biopsy tissue rather than blood alone. The gold standard for diagnosing lymphoma remains a lymph node or tissue biopsy. This procedure allows for microscopic examination and detailed classification of lymphoma. Fine needle aspiration or core needle biopsy may be used, but fine needle aspiration alone has limited sensitivity and accuracy for lymphoma diagnosis. More invasive biopsy methods are often needed for confirmation. In summary, while blood tests are crucial for evaluating patients suspected of having lymphoma and monitoring disease effects, they do not replace the need for a biopsy for an accurate diagnosis. Their accuracy in diagnosing lymphoma is limited, and they should be viewed as part of a comprehensive diagnostic approach rather than definitive tests on their own. If you have concerns about lymphoma, it is essential to consult a healthcare professional for personalized advice and diagnosis.